Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase them all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. For this week's episode, we will be comparing the book and real-life application of admin.
Where you sit at your computer and do all the fun stuff.
Yeah, the real reason we do this job.
We are talking all things admin today, including policies and procedures, the scope of an AT program.
Nice.
Rules of the ATR, who has access to your athletic training clinic, what do you have inside your athletic training clinic, how did you design an athletic training clinic or what should be in there, record keeping, pre-participation exams, HIPAA, FERPA, all of the above.
All the puzz.
Yeah, and it's honestly like admin is such a broad topic. It was hard to like kind of put together something that has real depth.
Yeah.
But this episode is actually sponsored by ATStudy Buddy, and if you want more admin depth, they are the perfect resource to go to. They are actually an online exam or a BOC exam study prep platform, and they go way more into depth, and you can actually like play games on different topics, not just admin, but they have like full length practice tests on different domains. They have so many resources. You can use code ATCornerStudent to get 10% off your monthly subscription price. So make sure that you use that when you are checking them out. And for more information, you can check out the show notes below. So this will be our actual final BOC IRL episode of this season.
Crazy. Time flies.
I know, for real. So if you are new, we do BOC IRL episodes as BOC in real life. So we take BOC topics and then we bring stories from athletic trainers and we talk about what those BOC topics look like in real life. So without further ado, why don't we start with policies and procedures?
Ooh, that's a good place to start when we talk admin.
Yeah, I thought so. So first thing, policies are different than procedures. Policies are those clear written statements that identify the actual rules and principles. So it's going to be more of like the what is going on and the why. And you use these for decision making, whereas procedures are the how. It's the process. It's how is something done, specific directions. So when we talk about policies and procedures, I feel like everything is kind of like under an umbrella, but specifically the policy is like kind of like the generic idea of how you're going to do things or of what you're going to do. Yeah. And then the procedure is actually how you're going to implement that. So like for an example, policies would be like how the organization is going to respond to something. It's not really intended as like a roadmap, whereas like a procedure would be like, how do you discharge someone from rehab?
Yeah, I was going to say, I feel like it's like a heat policy is we need to take core temperature.
Measures, yeah.
Right, that's how we're going to identify it. The procedure is, here's how we're taking core temperature.
Exactly.
That makes sense.
Yes. Some examples of some policies and procedures are like the scope of your operation, which we're going to talk about, hours of operation, open and closing tasks, referral policy, so like when you're going to refer someone, equipment use, maintenance, repair, emergency action plans, weather policies for like lightning, air quality, like Randy was saying, like what are you going to do during like if there's lightning versus like how are you actually going to implement it?
Yeah. We know we need to monitor.
Yeah.
But how are we monitoring?
Concussion management would be a good one too.
Honestly, any of your medical policies and procedures too. Like, hey, diabetic athlete, here's what we do and stuff like that.
So, I mean, I know we all kind of have standard ones, but then I did go ahead and ask what unique policies athletic trainers have. And some of my favorites were a documentation policy.
Oh, that's cool.
Yes. And actually I have had, we had one of our clinical sites ask us for our documentation policy.
Oh, nice.
Yeah. So that, and then a joint dislocation policy. I've seen that before. I really liked that idea. This one from Anonymous says, I'm not sure how many places have this as an actual written policy, but our parent communication policy is written into our standing orders, meaning in what instances do we contact parents based on the severity of the injury. Minor injuries that don't require follow-up treatment like blisters, bruises, etc. don't get contacted, while moderate and severe injuries are obviously always a parent phone call or text based on the situation. I like having that in writing because it holds us as providers accountable in keeping parents involved in the high school setting.
Yeah, that's kind of cool.
Yeah, I like that idea.
I think too, like someone who like say they had multiple ATs, you hire someone new, they might be like, I don't know what to do. So like this could be a really good way of guidance of like, nah, we got something for that. Here you go.
Exactly. Yeah, I feel like the policies, although you're most of the time, like when you have like pages and pages and pages of them, like ours, I think ours is up to like 47 pages or something like that. Like it's not like you're going to sit down and like read through all of them at once. Like obviously you should really familiarize yourself with them, like especially when you get a new job. Yes. But it is something that is a great reference point. Especially like before you have a situation, you can kind of get an idea of like before you get lightning, what is our protocol and what is our policy here?
Well, and it's great for, again, like if you're new somewhere, like you have something that you can look at to be like, oh, this is how we handle this, instead of being like going up to coworkers for everything and being like, how do we do this? Where like if we have some things on just policies and procedures, you can at least, it's easy to find. Or if you forgot, like, oh, wait, how do we do that again?
Right. So we do have an ATStudy Buddy break.
Yeah. Hell yeah.
I stole your horn.
Yes.
ATStudy Buddy so graciously provided with some questions for us to share. And one of the questions, the first question is, how is a policy defined? A specific plan for members of an organization to follow. B, a broad statement of an intended action. C, an organizational plan that provides program direction for 1 or 2 years. D, a mission statement of an organization. Or E, a vision statement of an organization. So policies can include your mission and vision statement, right? But those are not the policy itself, right? Let's see. Let's go backwards. C, an organizational plan that provides program direction for 1 or 2 years. That's not really a policy. That could probably be within the policies as well. The two that kind of stand out to me are a specific plan for members of an organization to follow and a broad statement of an intended action. And if we remember policy versus procedure, policy is more of that broad idea, whereas procedure is more of that, like, how do we implement it, the more specific, detailed.
For sure.
So when we talk about a specific versus broad, that policy is going to really be more broad. Mm-hmm. So the answer would be B. Policies are broad guiding statements.
Yeah, that's what I would say too.
All right, so next we are going to talk about the scope of an athletic training program. I kind of messed this up when I asked on our Instagram stories because I asked about who the scope is of your athletic training like institution, and I kind of talked about like what do we do about like coaches and bystanders, but I worded it weird, so I just threw it out, which is unfortunate because I was really looking forward to those answers.
Oh dang.
But I did get a really cool story that makes you think about whether you should include coaches or bystanders in your policy.
Yeah, it's a good thing to consider.
So this anonymous one says, I had to spine board a parent that fell down the bleachers back in January.
See, like situations like this.
Like, what are you going to do?
Yeah.
During a warm-up for a basketball game, he was intoxicated and the gym was packed. It hasn't necessarily changed my policy, but I have been called over to the crowd once or twice for emergent reasons.
See? So it would be nice to have an idea of, what do I do with this?
Right, because like you want to know ahead of time, so you know like how to act, right? And especially like if that is not written in your policy, or if you wrote that, like, I feel like it would be really awkward if you get called to the stands and then you don't do anything.
Yeah.
Like, obviously you're going to manage the situation and call 911, but
then what happens if the game's still going on and something happens in the game?
right.
Now what
So,
do we do?
right. So, it's a sticky situation and you want to make sure that you have yourself backed up. And again, we don't have to over legislate ourselves or overwrite. It's more of like an intended action.
Correct.
You don't have to have a procedure for everything. Remember, specific detailed plan, because a lot of things in athletic training are it depends.
It does depend. It's always a great answer that students love to hear.
Yes. So some other considerations of who to include in your I guess your scope. Athlete, are we doing prevention and care the entire year? Are we just doing competition season? Are we just doing like in season, out of season, non-traditional? What happens when they have like a spring game, when they're a fall sport? So what are you going to do about that? Are you treating all illnesses, or is it just musculoskeletal? Is it something that is like, if someone comes to you and they're like, oh, I sprained my ankle at basketball practice, but then later you found out that actually it was while they were jumping on a trampoline?
Of course.
What are you going to do about that? What if they say they were surfing and they got hurt? Are you going to cover that?
Yeah. What about just even at the basic? What do you define as an athlete?
Yes, that is an important one. What differentiates a tennis athlete versus someone who's
like in a class?
In a tennis class?
Yeah.
At the institution, who receives care? How should they be referred? What about clinical setting for students?
Mm-hmm. Yeah.
In the community, will any outside groups be served by the AT staff? Can people use your athletic training clinic?
Yeah, that's a big one. Especially if you're a place that always does facility rentals.
Mm-hmm. Really big.
Mm-hmm.
And then also, when your coaches come in and ask for your professional opinion on themselves or their kids,
yeah,
which happens all the time, how are you going to handle that?
Yeah.
Just some things to consider.
Yeah, some things, to think about.
Something that was also brought up in our conference in the past was visiting athletes and how do we treat them, because if I actually had to change the wording on some of my previous policies, because the waiver that they would sign, the consent to treat, would only said like the institution and the athletic trainers institution and like similar things like that, and it didn't say anything about the consent for the visit, like if they're
that's a good point,
at a different place. And like obviously I have no idea what the other athletes and what the other schools write.
Yeah,
I hope that their consent to treat also includes the visiting team athletic trainer, or the hosting team, I guess.
Yeah.
Hosting team's athletic trainer. So something to take into consideration when you're writing your consent to treat forms.
That's a good point. I didn't think of that.
Mm-hmm. And I think technically you're supposed to send that consent to treat with them.
I think so. I think technically you're supposed to.
Yeah. Another big thing to consider is, how do you determine what event to be at when there's more than one?
That's a good one. That is something that, like, we kind of talked about in the informatics episode and what I talk to my students about all the time.
So some people don't have to deal with this, which is nice, but a lot of people do. Mm-hmm. So I did ask on our Instagram stories, how do you determine which one you go to? And some places actually have a list, like listed out, like these, it's going to be in this order. This is the hierarchy. Some people say collision. Some people like group collision versus contact versus no contact, and that they kind of group it by that. Some people say like level. So like varsity is higher than JV, and so they're going to go to varsity. And then lastly, I also saw a lot of answers that talk about the number of people at the event.
Yeah.
Which I never really thought about, but I guess that would make sense if you're kind of on the fence that you're going to go to the one that has more people.
Yeah.
Robyn S says, choose a higher risk or highest level. Varsity takes priority over JV. I decided the highest risk by which has the most amount of contact between players. Usually I don't have to worry much about that at the high school since there's only one competition field / court that kids can be using. I'll never have to choose between football and soccer in the fall or lacrosse and soccer in the spring, which I thought was very interesting.
Yeah.
Like, that's kind of actually really nice and something to take into consideration if someone ever asks about, like, sport fields or, like, when they're building things.
Yeah, like, hey, we should add a second field.
Nope. No.
Or
you should add a second athletic trainer.
Yeah, if you're thinking about the second field, here's what that's going to mean.
Right. Some talking points for sure. Robyn continues, my mental flowchart for each fall is football, soccer, volleyball, cross country. For winter, it's wrestling, basketball, flag football, gymnastics. For spring, it's soccer, lacrosse, track, softball, baseball. I put track first because it's more athletes and I can be at a central and easy to reach location between them at any other games happening.
Nice.
Yeah.
I mean, this is where keeping data too helps. You can actually
absolutely.
You can actually keep track of, well, what sports do I tend to see the most injuries or the most catastrophic injuries, which has the highest risk, which has the higher rate. Again, going back to the informatics episode.
Right. Which I always tell people, both of my coworkers have lifesaver awards from baseball athletes. And we have 21 sports on campus. So with that being like the most technically catastrophic injury.
Actually,
crazy. Kathleen T says, if I am solo, I station myself at the highest risk sport and will respond as needed to other events. I always notify a coach I'm leaving if I'm called elsewhere, and my coaches know to specify on the radio if the injury is emergent or can wait as I finish up at another injury, if applicable.
Nice.
I also provide teams with small med kits with first aid supplies for both home and away games to help reduce the amount of times I leave a high-risk sport.
Nice.
I actually really like this too because training the coaches is so important. We have coaches who will text us like, we need a trainer. And like I rush out there and they have like a boo-boo on, they have like a paper cut on their finger. And I'm like, I just dropped everything to come out for this. Like,
I thought someone was dying.
Right. So obviously it's a bit of a different emergent level. Yes. So we have been working on that. Moving into the ATR, what rules do you have to keep the ATR clean?
I do have to say my kids do a pretty good job of not making a mess. So I'm pretty lenient with them about like with their food because I just let them know like, hey, just don't make a mess. Right. But if there is someone that does, they do clean it.
That's good.
Yeah.
The book technically says some rules should have no cleats, no shoes on the table, no food, shower before treatment, those kinds of things. When I asked it on our Instagram stories, those were pretty popular. I would say the no cleats one was probably really big.
I always forget.
Some people, actually, I was really surprised how many people actually don't allow shoes at all in the athletic training clinic. Like, I've probably heard about like 2 athletic training clinics that I can think of that don't allow shoes. But we got a lot of responses that actually included
Interesting. Well, I always forget about the shoes on the table. Like, someone comes in, I'm already ready to start working. I get them on the table. They're on the table. I'm like, dang it. I forgot to say no shoes.
See,
definitely no cleats. Like, I mean, granted, I don't have a sport. I'm indoor, so I don't have a sport that has cleats anymore.
That's true. See, for me, like, I try not to get the shoes on the table, but like it's not the end of the world because I'm going to clean the table anyway. So I feel like to me, it's not the end of the world, but we do enforce it.
Yeah. And sometimes it's like, just if you hang your feet off,
right,
that's fine.
Yeah. And sometimes it's better than stinky feet.
Dude, I had one athlete one time. Oh my goodness. Like, again, I've smelled it all. It doesn't really bother me, but there was one, like, actually, this was actually pretty bad. Like, you knew he was in the room.
Oh no.
Even after he left. And I was like, bro, that's bad.
Oh, that's not good. This anonymous one's cleanliness says, we sweep the floor daily and deep clean weekly. Anything that's used often gets a wipe down once a week. Rehab equipment, ice machines, sanitize to prevent buildup. Cleaning countertops and mopping as well. Tables, bottles, jugs, and modalities are obviously sanitized every use. No shoes ever on tables. All my kids know that each shoe put on my table is a 5-minute plank per shoe. I mean, that's definitely a way you can keep the shoes off the table.
That's pretty funny.
You can enforce that very easily.
You know what I think I need to finally implement that I've seen other people do?
Mm-hmm.
Once a kid's done with the table, I need you to wipe down the table.
You know what? Some of my athletes just do that on their own. But you know what? It's probably thank you to probably their high school athletic trainers. I assume that's probably what it is.
Honestly, I have had that where some athletes will grab the bottle and just spray. They're like, which one cleans it? And I'm just like, that one. They're like, okay. I'm like, okay. I think I should do it now. And the cups.
I feel like it's actually pretty I would say maybe about like 30% of our athletes probably clean their own tables.
I think I'm going to start doing it for the cups too. After I'm done with the cups, be like, I'm going to need you to wipe those down for me, please.
You can do that. I'm not going to do that. I feel like that's my job.
But what happens is I'll be busy. I'll take the cups off. I set them down. I've used all the cups. And then I was going to cup someone else. And I'm like, dang it. Now I got to clean the cups.
See, I wipe them off as I take them off. And then so they're not clean. They're just wiped off. And then I don't put them back. But then it's a quick spray and wipe to clean them when I need them again. Versus because it's the lotion that's the big goopy gross part.
Yeah.
So if you do that when you first take them off with the towel from the athlete, so then you're just taking the gross lotion off.
For sure.
It's like a 2-step process, but it's so quick.
Yeah. No, for sure. Okay, maybe not. I don't know. For sure at the table.
Work in progress.
I'm for sure doing the table. But I say that, and then I'm going to forget, and then I won't do it.
Okay, so let's actually talk about the supplies in the athletic training room. So going back to some book definitions, we have expendable versus non-expendable, and we also have consumable and non-consumable. So when it comes to expendable, I feel like expendable and non-expendable is a little bit more obvious. Expendable is going to be like things that cannot be reused, so you're expending them.
Yeah. What? You don't put the tape back on the roll?
No. Tape, bandages, hydrogen peroxide. Please do not give me your used Band-Aid. That's disgusting.
I thought you were going to say your used hydrogen peroxide.
Yeah, like you can't take the hydrogen peroxide out of someone's ear and put it back in.
See, that's where they give you, can I borrow a Band-Aid?
Yes. So those are expendable supplies. Non-expendable are things that can be reused. So like ACE wraps or compression wraps. Scissors. Hopefully you're not buying scissors for every time you cut off a tape. Right, that you can use those again.
Yeah, which the non-expendables are my biggest pet peeve. I hate having to replace those often, or like more often than they should be. Like that is my biggest pet peeve is like braces.
Yes.
Like that should last me for a while.
Okay, so I'm going to take the smallest, hopefully, tangent because I could get on a soap opera about this. I mean, a soapbox.
I mean, it could become a soap opera.
It could totally become a soap opera. But I have noticed something, and it has changed my perspective. A huge change in my perspective. There are some people who will buy really nice things and keep them nice.
I try to do that in my clinic.
There are also people who buy shitty things and don't care how they treat them.
Yes.
Because they're shitty.
Yes.
And then there's also the people who are kind of like the mix, who maybe buy nice things, but treat them shitty because they can fix them and they're okay. Like they're okay with them not staying nice. And it is the biggest disconnect from those 2.5 type of people who treat the way they treat things differently, the way they buy things and purchase things. Because if you are as a staff trying to like buy things or keep things nice or like fix things or, you know, whatever it is, it's almost like a quiet disconnect.
Yeah.
That actually makes so many waves.
Yeah. For sure.
And, you know, that's something I noticed. Like you and I like to buy nice things, but we keep them nice. And not everyone, like, I could totally appreciate someone who, like, doesn't want to spend the money on something like that and they're just going to replace it. But you have to recognize the differences between those people.
Yeah, absolutely. And that's why, like, all my braces, like, I do wash them by hand. Like, now granted, I don't work football, so I don't have like a million braces at one time, right? So like I do have a small amount of braces that are being used, but I just don't like them being thrown in the laundry. And because somehow they're going to end up in the dryer and then the dryer is going to destroy them. So I do it by hand.
Yeah, I mean, that's a really great idea.
Yeah, because I want to maintain the life.
And you want to keep them. You don't want to buy those over and over
that's
again.
That's why I keep track of my braces.
Because those are non-expendable.
Yeah, and I hunt kids. I let kids know. I'm like, hey, you better not lose this brace. And
yeah, not on my dollar.
Yeah, they laugh at first. I'm like, you better not lose this brace.
So I need a better system here, but at my last place, I had a really long desk. And so I had a section of my desk that was kind of unused. And actually it was used by this pile of braces that I had. So basically I'd keep the box of the brace. We had a really, really nice donation of like a whole entire cabinet full of like braces and stuff that we could check. It was amazing. And I wish that I had access to that, but I do not. Anyway, so I had like all the boxes. And so like what I would do is I would take the box and I'd put it on this stack in my desk. And I put a Post-it note with the person's name that was like my sign out. And then like when they brought it back, I would take their Post-it note off and then put that box back in the cabinet. And it worked out so well because I didn't really have to, like, I've tried on sportswear. I've tried on a piece of paper. I've tried like.
I do it that way.
Yeah. Some, you know, like there's this idea of like friction and.
Yeah. I get that.
If you get things done and if you can't get these things done, if there's too much friction. And that was my frictionless system of sign in, sign out. And you know what? I didn't lose any braces that way.
That's nice. I do it by hand. And for the most part, it works. But again, it does rely on me remembering to, one, put it in, and then two, to hunt the kid down again.
Right. So moving on to consumable and non-consumable. Consumable, actually, we're going to start with non-consumable because I think it'll make more sense. This is like supplies that are not removed from the athletic training facility. So like your treatment tables or your ice machines or your modalities. Like those are all like
chilling there.
Yeah, those are non-consumable capital. Whereas consumable capital is kind of like your idea of like those expendable supplies, except your non-expendable supplies, like your crutches, your coolers, your kits that are like the supplies that make the athletic training room like the athletic training room, but they're
mobile.
Mobile. Consumable capital.
Yes.
I hope I explained that well.
I think so.
Okay, let's move on to the actual athletic training room itself. So I did ask on our stories if you have ever been involved with designing or creating an athletic training facility, and only 32% of people said yes.
I could kind of see that because I feel like you're really relying on the place to be designing a facility, which it's never just like your thing.
I mean, how
it's like looped in with like, oh, we're getting a new gym or we're getting a new football stadium. So we are going to put the athletic training clinic there.
I just realized that I've had input on one, but I left before it was
actually same.
Open. Yeah.
Actually same.
Right. I totally forgot about it. I actually have never gone back to see
what it actually became.
I know.
All right, we're making a trip.
Well, yeah, we should.
Going on a trip.
Christina S said, I had mild input. I wish I had a little more say.
Which is how it always goes.
Yes. But they did listen where it counted. Lots of outlets, access to hot and cold water, made my door a glass door since I have no windows, and bought everything I asked for.
Nice. I mean, you can't be too mad when you say they bought everything you asked for. You're like,
I know.
I'm mildly annoyed, but now I'm less annoyed.
Ours was for a satellite athletic training room, and they were like, do you want these high-low tables? And we're like, yeah, even though it was like a satellite that we were never going to use. But we're like, let's take those and put them in the real ATR and then switch out our tables.
How come I don't ever have anyone ask me, do you want high-low tables?
I don't know. You're being asked by the wrong people.
Apparently. I want high-low tables.
High-low tables are very nice.
That's a game changer.
Although, let me tell you, as someone who has high-low tables, something that happens probably weekly, and why if you ever see me in the athletic training clinic, you will always see that I take the stools and I move them out from in between the tables, because all the time, and it just happened today, when I'm adjusting the table, when I'm adjusting the table, someone placed a stool underneath the table. I don't know how this happens so often. It literally happens so often. And then because I'm short, I have to make the table go like really low. And then as it's going down, all of a sudden the table starts like tilting to the side. And well, it is actually very funny, but I have to I'm like, oh shoot, like there's someone on the table. Like they're going to fall off this table because it's literally tilting. Because there's a stool underneath it. And then I have to press the up and wait for it to go up. And then I have to remove the stool. And then I have to make it go down again. It literally happens all the time.
That's very funny.
Speaking of up-down, if you do get up-down tables, you're going to need a lot of outlets.
Yes, you will need a lot of outlets.
And speaking of outlets, some things you might need to know about those AT facilities. So for electrical, GFIs stand for ground fault interrupter. These are needed in the ATR, especially in areas of water. We love our GFIs because we accidentally trip them all the time.
Yep.
So it is good. And they're tripped when there is more than a surge of 5 or more milliamps.
Yep. Saves your life. That's why it's there.
Yes. Electrical outlets should be several feet off of the floor. According to the book, I think it's 3 feet from the floor.
I believe so.
And then in the water area, I believe it's 4 to 5 feet above the floor.
True. I think that's true.
And then just make sure that you're not overloading the outlets with modalities.
Yeah.
Some other things about AT facilities you want to look at. The size that's based on like institution and the number of athletes serviced. The location, you want to make sure that the injured athletes aren't going through like 7 doors. So it should be pretty close to having an outside entrance. The entrance should also be ADA handicap accessible. Illumination, I put this in there specifically because I just wanted to read this quote from the book. Natural lighting through windows or skylights can be helpful. There's
no athletic training room like that.
No, wait. I asked on our Instagram stories, what is your AT facility dream? And of all, like literally this is like a question that like no one is funding the like your athletic training room. No one is like putting any stipulations on you at all. Like what is your specific dream? Is it like an in-ground whirlpool, or like what is specific about your like if you had endless money, right? Like what is your facility dream? The number one answer was Windows.
Oh, I bet.
Isn't that crazy?
See, the people, it's funny that you brought up the like the in-ground like whirlpool, or like you can even do like the jacuzzi style ones. Everyone wants them until you have them,
and then you have to clean them.
Then you got to clean them. And if you've ever tried to clean a jacuzzi before, it's the worst thing ever.
Okay, so I just thought this was so funny because
is funny.
It wasn't even like it got twice as many submissions as the next popular answer.
I mean, it's true.
Like twice as many.
It does make a difference.
The next popular answer was a private office.
I would agree with that. Because in my actual clinic, I don't.
Oh, you're right.
And it does, like, it's not that big of a deal. I mean, granted, I've had an athletic training room that was just a warehouse. So, like, I'm just glad to have walls. So,
I think there's pros and cons.
There is.
I think it is much better to have a private office, but I think it depends on what you are responsible for. Because, like, for example, at my job, I tell people all the time, I'm like, I don't just sit at the computer all day. Yes, I do. I sit at the computer all day long. I have so much admin much admin to do. And like today, I was at the computer for so long.
Well, and see, that's the thing is why having an office would be nice is because like in my clinic, like I have my computer things I need to do. And I just want to lock in sometimes and just finish that real quick. But when I have athletes all over the place, like obviously like
it's hard.
They're talking amongst themselves, right? They're going to want to interact with you, which is great. And like, I want to get to know them, like what's going on, stuff like that. But it's also like, dog, like I've been trying to type the same sentence 3 times.
Yeah.
And I've failed each time. I just need to lock in.
Yes. See, that's the thing is like, it's a pro that you can like have access to them while you're working on the computer. So you can kind of multitask. But the problem is you have to multitask.
And then sometimes you feel like they feel bad because they're like, oh, well, I thought you were working. It's like, no, like I want to take care of you. Like, what do you need? And then also too, like sometimes I'm on the computer. I'm like, God, they probably just think like I'm ignoring them.
I know. It's because you always have literally always have computer stuff to do.
Yeah.
Like always. You will always have computer stuff to do.
Yeah.
We were just talking today about the emails. Like you just get never ending. Like I am on to like other than my like normal emails and stuff, like I am on these 2 like massive threads about insurance and like and like calling the insurance and then getting back to the insurance and trying to like figure out why this kid can't get PT and why it's going to cost him so much money to get PT because this insurance provider is not providing EOBs. And like it's like this whole thing that like the athletes are like, can I get heat? And I'm like, you know how to get heat. I need to deal with this insurance thing that is like some other AT facility dreams. Hayley S says would love an office space separate from the ATR. Oh, we just talked about this.
Yes.
Wet room, a nice rehab space with 5 to 10 yard turf patch, nice metal cushioned tape tables, a new weight bench and dumbbell rack. The list goes on. A turf patch would be insane.
Yeah, that'd be cool.
I would use that so often.
That'd be cool.
I mean, granted, I just go outside with them, but like it does take me outside the ATR.
Yeah. I was just going to say like either my athletic training room this size or like attached, like literally attached to the weight room. Like where I was at that had a warehouse. Like
attached to your school's weight room. So like when football is going, they're going to Or
No.
so you have
I
access
have
to
access
weights.
to weights. Like a legit weight room, though, too. Not like just like, oh, the fitness. No. I want squat racks.
Yeah.
Like that, like where I worked, where it was just a warehouse as my athletic training clinic. We actually had the weight room right there. And it was really nice. Because, like, we could start doing more advanced rehab stuff.
Right.
Yeah.
That is nice. Emily M says, in addition to Windows.
Yeah.
With, by the way, 4 exclamation points that include privacy filter /film, adjusting tables, huge rehab space with gym, weight room flooring, not carpet or tile. That includes wall space, adequate office space. That means you are not constantly interrupting conversations or trying to find places to have those convos or meetings, calls, Zooms. See, that's nice.
Yeah.
Doc office and private treatment space for AT students so they don't end up at desks or hiding in the back, cubbies /storage for athletes' items when they come in.
Honestly, the cubbies and storage would actually be legit because it does help a lot. Because especially with my room, it's like small.
Yeah, I don't know where do you put all your kids' stuff? Because we have like cubbies.
Like, so for like the student athletes, most of them don't really bring in a ton of stuff.
Because they have their locker rooms right there.
They do have like my indoor teams have their team rooms. So they definitely don't really bring in their stuff.
That's nice.
Aquatics, obviously their team room is not in my facility. So they do bring their stuff. But for the most part, like it's not in the way. Like sometimes they do bring it in, but they put it down in a place where I have not noticed it bothering me.
That's really good.
Yeah. There is one time though, some kid brought a scooter. Like I swear, you can't make athletic training you can't make this stuff up. This kid brought a scooter. I don't even know who the kid is. I think he was trying to play basketball. I don't know. Came in, said something to me, didn't even ask, just said hi or something, left his scooter and walked out.
Oh, I kind of remember you coming home and telling me the story.
And I'm like, what happened? So there is that.
Oh, there's more. I missed this part.
There's more to this dream.
In-ground underwater treadmill and hot cold tubs, glass room with boost treadmill, bike, regular treadmill, etc. Some form of tech to do some testing, Vlad, tin deck, etc. Bathroom, storage that makes sense, functional AC heating, locker room area for ATs close by. See, all those things.
That would be cool.
Yes. Someone actually sent us a picture of where Tori Lindley worked, and it overlooked Lake Michigan, and
that's kind of cool.
Holy moly, it was beautiful. Like,
that's kind of cool.
Let me show you this. Like, is that not stunning?
Holy smokes. Holy smokes.
Like, that is like the floor to ceiling windows is insane.
It would be cool having like the organ, like when you touch the glass, it goes frosted, and touch it again, it comes back.
Oh, that is fancy. Yeah. That is so fancy.
I'm sure that's not cheap. Ooh, I wish my door did that. Sorry.
Oh, that would be cool.
That would be kind of cool. Because sometimes I'm like not ready to open up the clinic. Because again, I'm like, I have a meeting or something. And like I'm on Zoom at the computer and kids will just stare at sit at the door. And I'll be like, I'll give them the sign of, hey, 1 minute. And they'll still just be standing there. Like, dog.
That's annoying. Rehab area was also a big answer.
You never have enough of that space.
No. I was actually surprised that storage wasn't higher.
Ooh, actually, yeah.
But I guess people are not thinking of storage as their like
space.
Yeah.
Their clinic.
Yeah.
Yeah, storage is always a problem.
Let's talk about record keeping.
Heck yeah.
So, when we talk about records, like medical records, some things that we are including in that are injury reports, treatment logs, personal info cards, injury evaluations, progress notes, supply and equipment inventories, and annual reports. There is a difference between an EHR and an EMR. So EHR is a long-term collection of an individual's healthcare, whereas the EMR is a patient record. electronic medical record that is created and used for specific visits in a clinic, hospital, or physician's office, or in an institution, and it can be accessed by healthcare providers within that institution. So I did ask what EMR people use, and by far the most popular answer was Healthy Roster.
Interesting.
Which I hear that people love. I feel like that one's been like growing exponentially.
It has. I agree.
35% of people in our responses said Healthy Roster.
That's interesting.
Which is funny because that used to be like sportswear used to be the big one.
I know.
But sportswear was only, let me do the math on this. Only less than 2% of people in our, in like our question box put sportswear.
That's crazy.
Right. So, you use sportswear, right? Yeah.
Yes.
Yeah, we both use sportswear.
I mean, I do like it.
Some people use Epic.
That's crazy.
But actually, that one wasn't popular either.
I feel like that's probably got to be tied to like a hospital system.
Yes,
that's pretty powerful.
Right. Actually, so it goes Healthy Roster by far, and then sportswear, and then this thing called Teamworks Smartabase.
Oh, never heard of that.
Which I am not 100% sure if that's one that I have used, but it's one that you can like build out. So
that could be cool.
I know the possibilities are endless.
Really?
Emily M says Teamworks AMS, customizable to your needs. Works with Teamworks group, upload entry. Each person can change their view to preferences. We had a rough transition initially. Our contact person was brand new to the company and kept telling us what we couldn't do that we were requesting. A staff member moved on to a new job last year and said, hey, their AMS can do everything we wanted ours to do and more. So we started asking more questions. I asked some more pointed questions at their booth at NATA, and that got things moving more. We have a new person, and the difference it has made is huge.
I'm going to look into this just to know what it is.
I know, seriously. So that one was actually a lot more popular than I expected, because especially since I had never heard of it, but I think that I might have used it at one of my jobs before. But I wasn't part of the process of like building it, and I kind of thought that it was built just for this specific thing. I didn't realize that it was like a company, I guess. Since I worked for such a large company that has endless money. So
true.
I just didn't think that was a thing.
True.
ATS, Rank 1, Final Forms, AT Genius were all kind of some of the lower ones.
I have not heard of any of those.
Really? I think those are more popular at high schools.
Maybe.
That's probably why you haven't.
You know what? Honestly, probably why.
And then some other ones I've never heard of that people submitted. Activate, Kitman.
Oh, I know that one.
Which one?
Kitman.
Oh, really?
Oh, yeah.
Is that the one you use it at one of your places?
Yes.
I think I know what you're talking about.
Yeah.
I thought that I had never heard of that, but no one said anything about Core AT, which is a free EMR.
Yes.
I've used that one. I currently use that one. But let's do another ATStudy Buddy break real quick. So, yes, exactly. In athletic training, what function has database software been primarily used for? A, write letters and produce forms. B, perform simple calculations and integrate text with graphics. C, store and retrieve information regarding athletic injury and treatment. D, merge lists and develop spreadsheets. And E, all of these. Let's narrow it down.
I was going to say, honestly, I feel like if you just break it down based on all of those, there's really only one that talks about
injuries.
Yeah,
I feel like that too. So C, store and retrieve information regarding athletic injury and treatment. Primary use is storing, retrieving injury and treatment data.
Yeah.
Let's move on to our kind of final areas. So PPEs. So when we talk about like doing a pre-participation exam, which should be done on every person who's participating, according to the book, the team physician and the institution actually do have a legal right to restrict someone from participating as long as it has a medical reason behind it. And that medical reason has to be highly individualized. It has to be reasonable and based on that evidence that they find in the PPE. I did ask if people host PPEs and who is all involved in that. 54% of people actually did say yes, they do host, which I don't know what I was expecting off that, but that's like half and half.
Yeah, I wonder. I feel like the less and less that I've seen are offering them.
I feel like that too. I mean, it's so hard. Like mass physicals are hard.
And I think we did an episode.
We've done the last couple seasons. It's been our first episode back.
Yeah. So like, it is a lot of work and it's hard.
I think it's worth it. Like I think that
it can
sending someone to an urgent care that has no orthopedic background.
I agree.
Versus sending someone to one of our orthos on site. Like I think that has a lot of value. Also being able to talk to them about mental health there. Being able to follow up with them on something like because I saw them firsthand. I feel like there's so much it's hard. We do like 4 like full days of physicals.
Again, I think it depends how it gets done because you said there are a lot of benefits to it too.
Right. Bailey W says yes, but no. They are offered for free at the ortho office close to us, and we help out on them.
Nice.
They sign up for a time slot online to register. It's offered by the county our schools are in, so there's 1 day per county. Some do Saturdays, some do weeknights. It's first offered to the schools my company works with and then sent out to the rest of the county schools. 1 AT from the schools in the area, and sometimes a couple others come too. We get our student aid programs involved with them as well, and they get to help with height and weight and BP and eye exams. Then the orthodox and fellows are there too.
Nice.
So here is our final ATStudy Buddy break.
Here we go.
During a pre-participation exam, an athlete reveals that they have had surgery during the summer that may affect their sport participation status. The athletic trainer contacts the surgeon to learn what the details are of the surgery, but is denied access to the athlete's records. What federal legislation is responsible for protecting the athlete's medical information? A, Americans with Disabilities Act, so that's ADA. B, Family Educational Rights and Privacy Act, that's FERPA. C, Health Insurance Portability and Accountability Act, that's HIPAA. Or D, Title IX, Education Amendments of 1972. So I actually did also see a BOC style question that had what does HIPAA stand for, and there were a bunch of very leading or very convincing answers. I feel like the portability gets people, health insurance portability. But there, I would say, so we know ADA, it's probably not ADA, right? Yeah. We know it's not Title IX, it doesn't have to do with gender. And our other two answers are HIPAA or FERPA. And when we're talking about an institution, those things can be very similar. But when we're talking about medical specifically, they're probably not going to file under FERPA. So the best answer for this would be C, HIPAA, because it protects medical records and patient privacy. But I did want to go over the difference between the two real quick. So HIPAA is Health Insurance Portability and Accountability Act. It regulates how healthcare professionals can share the private information with others. FERPA is specifically family educational rights and privacy, which you'd think just is like education. But the some places that your medical records through the school like get looped in with that. But it basically gives parents like rights along those records. And because of like institutions, usually those like fall within the medical records, fall within educational records, like especially if they have anything to do with them. So it would be helpful to ask your admin and double check if you are HIPAA or FERPA or both.
Yeah, no, for sure.
Do you have anything else to add on HIPAA or FERPA or anything?
No, that's usually the biggest thing is just making sure like what your institution has, or what you're going to fall under at your institution, because it also goes into like some of the softwares that your institution may offer you. Like again, like most schools are probably most state institutions are probably going to be a Microsoft kind of Office thing. So if you're going to use Microsoft Forms, like for some of your forms and stuff.
Well, if you're used to Google, then you're going to have to switch to Microsoft Forms, because you have to look at like things like end-to-end encryption. You have to look at things like the BAA agreement is the number one thing you have to look at to make sure that you have that under your school, because if not, you are actually not HIPAA compliant.
Which, I mean, for a school, if they're having it, like more than likely they probably do because of FERPA. But yeah, you do definitely want to double check that.
Right. So that's something to look into. But the basics of this, I feel like the other BOC IRL episodes were very like pointed and specific to things, whereas I feel like this admin was more like, here are some things you have to consider, and those are it's kind of how admin goes.
Yeah, it is, and it is very place dependent.
Yes.
And resource dependent. Like there are kind of general guidelines, but it's also kind of like those guidelines also kind of depend on even just state to state and employee setting to employee setting. So yeah.
Well, we are on our final couple episodes here of this season.
Crazy.
But if you guys are interested in hitting up some other BOC IRL episodes or any of our other episodes, we also do interview episodes where we bring in a speaker on a highlight topic. And then we also have episodes that Randy heads that are educational episodes that once you graduate and are certified and need CUs, or even if you don't need CUs and you just want to learn and get ahead, or just deepen your knowledge, because that's what you're here for, right? Those episodes, Randy reads a ton of research articles and we talk about them conversationally, and they are good for category A CUs. So when you're ready for those, make sure you hop on that train. The latest 5 are free, and the last any before that are purchasable. 50% of proceeds go to support the show, and the other half go to donate cold tubs across the country to athletic trainers in need. Again, if you are interested in ATStudy Buddy to help you study for the BOC a lot better than we can, because we're here mostly for the fun.
The BOC is not fun.
Use code ATCornerStudent at checkout. All that information is down below. And I think that's all I have.
Thank you for helping us showcase athletic training behind the tape. Bye.